all experienced a whirlwind of emotions as the COVID-19 pandemic put a halt to our normal, daily lives 3 years ago. Since then, it's been a roller coaster ride with moments of triumph and heartache that shaped our lives in ways we've never imagined. My name is Nancy Quiroz-Gomez, and I am a nurse educator at St. Peter's University Hospital in New Brunswick, New Jersey. In this episode, I'll be speaking with Maria Bartman, the Stroke Coordinator at St. Peter's. She worked in St. Peter's Emergency Department during the pandemic. Together, we'll delve into the personal and professional impact of the pandemic. Maria, welcome to St. Peter's Better for Life podcast. How are you doing today?
I'm doing well. Thank you so much for having me.
Thank you for joining us. So I wanted to just pick your brain a little bit. You worked through the pandemic. So what was your role in St. Peter's Emergency Department during the pandemic?
So my clinical background is the emergency department. That's where I've practiced as a nurse for my entire career. I took the role of stroke coordinator the summer before the pandemic. So when the pandemic did hit, initially the role was a part-time position. So I was supplementing my part-time position by working in the emergency department anyway. So during the pandemic, I was picking up time in the ER, and eventually, because of our volume, I ended up working full-time in the emergency department. So I was back home working in my home department.
So you were pretty much working in the ER throughout the entire pandemic here at the hospital.
Correct.
So what, take us through what it was like at the beginning of 2020. What was your experience throughout the pandemic? Like, what were your thoughts, right, when we all were noticing, okay, there is going to be a declaration of a pandemic? What was COVID? Like, what were your feeling, your emotions through that? Because I didn't feel fear. It was more like, okay, what's going to happen now? And then it hit me like, wow, we're going through something strong.
Initially, it was like, oh, well, this can't be that bad. I mean, is it really that bad? Is it going to be that bad? Exactly what is going on? What's going to happen? And then slowly we started seeing cases. I know initially we did have a few patients who had come in who perhaps had some exposure. But the guidelines that were set out by the Department of Health were pretty clear. So it's important to have like a rubric, because you can't be assuming that everybody, or at least at the beginning, we weren't assuming that everybody could have been exposed or was exposed. So we were definitely going by the guidelines that the Department of Health had set ahead with regard to testing people. And then more people started coming in with symptoms. So we were testing more, and the patients were definitely much more concerned who were coming in, well, maybe I was exposed, maybe I do have these symptoms. So it was definitely, as we had more patients who were coming in, it was definitely much more scary. I mean, because you didn't know exactly what you were dealing with. And even now looking back, I think that there's a lot of, there's still a lot of questions as to, long-term effects of COVID and COVID in different populations.
Did you feel like, what was the atmosphere like in the ER? Because funny enough, I also worked in the emergency department prior to a nurse educator position. I worked in the ER as well, and I was in an emergency room during the beginning of the pandemic. So for me, patients coming in and out, every single patient that stepped into the ER was positive, right? So, and some patients that came in, they had no idea what COVID was. They just, I feel sick, I'm here. But it was, for me, I felt chaos. I felt like we just had to kind of gather together as a team and keep each other sane, right?
Right. Absolutely. I agree. And then it was, are we masking? Are we not masking? Are we using those N95s? Are we not? Which patients are, and even like the medications, I'm sure patients who have respiratory complaints come in and they get their nebulizers. Well, now we don't want to be using those nebulizers because now we're aerosolizing everything. Mm-hmm. So even our practices ended up changing, and then remembering those changes.
Like during any given day, did you feel like, okay, this is how we're going to prepare ahead of time? Did you find that to be even helpful, right? Because there's so much, as you know, the ER is unpredictable. So you never know what's going to walk through the door. You never know what's going to happen. But was it in the midst of said chaos, was it easy to prepare, I guess, ahead of time for a given situation?
I don't know how easy it was to prepare. We were very lucky here at St. Peter's. I don't remember the name of the department that sources all of our equipment, but I think that we were very, very lucky. There are other areas or other emergency departments, like in the country, that were not able to source, that didn't have like all that PPE that we needed to have to keep us safe, to keep the people that are taking care of the people who are sick from getting sick. So I think that we were very lucky in terms of preparation when it comes to that. But like preparing yourself, I don't know.
I remember, I could tell you that I had one night, and I don't even remember what month it is, maybe April, when we were right smack in the middle of everything of 2020. All my coworkers, different ethnicities, different races, right? We just looked at each other, we held each other's hands, and we all said, like, we said a small prayer, right? Just that never happened before. We all respect each other, we work well together, right? But it was just that one moment that felt that moment of solidarity that we've always had, but it just felt very powerful because we all held each other's hands. We said a little prayer, and it didn't matter where we were from, our nationalities, or race, nothing. We were united at that moment in that front to treat this situation, right? So our patients saw us, and they were fearful, they were crying, had so many questions. In your experience, what were your patients telling you? As you're their nurse, they're looking at you, they're looking for you for comfort. But I'm sure at some point they may have even seen our own fear, right? So what were your patients telling you that you could recall, like maybe something that stands out?
A lot of the questions were related. The area I worked in fast track a lot, so a lot of our patients were treat and release patients. There were a lot of questions of, are my family members going to get sick? Is this something that I'm going to bring home? How do I keep everybody safe? I know I'm sick, but how do I make sure that nobody else gets sick at home? So those were many of the patients that I had taken care of. Were patients who were going to be going home who had tested positive because they were okay to go home. How are they going to keep their family members safe?
Any challenges throughout, I don't want to specifically say 2020, but I guess during the pandemic itself, like what were any major challenges that you found being in an emergency room department, since you're like the first point of contact, right?
So one thing that's specifically related to stroke, actually, is we had been telling patients, don't come to the ER unless you're really sick. So there are quite a few cases, not necessarily at our hospital, but like anecdotally that I had heard through through our stroke consortium, that there were far less stroke cases that were coming into the hospital. Patients who have stroke-like symptoms oftentimes ignore them. Where, if you're having chest pain and your arm hurts, you think, oh my gosh, I'm having a heart attack. Let me get to the hospital. Let me get taken care of right away. With stroke, it's a little bit different. It's, oh, I've got some numbness. Those patients that obviously have, difficulty speaking, that sudden onset of one-sided numbness, they're more likely to come in or have a family member bring them in who notices the symptoms. But those patients who had more subtle symptoms, would ignore them and then would come in with far worse symptoms, or they would come in with, say, an ischemic stroke, which is the kind of stroke where there's a blockage and your brain cells start to die, versus a hemorrhagic stroke where it's a blood vessel that bursts. There are patients who are coming in with hemorrhagic conversions of their ischemic strokes. So their symptoms were far worse, and they hadn't been treated because they were afraid to come to the emergency department to be treated for those symptoms.
Because they were worried that they would get
Get
COVID,
something worse, that they
right?
would get COVID.
But tell me, I know you and I have worked at other community events, and I remember a patient asking about, what do I do if I'm home by myself and I feel sick and they're worried about stroke symptoms? What can you tell the audience? Like, what other signs and symptoms should they be looking out for?
So we use the acronym BFAST to help educate the public, and also for us to remind us of what stroke symptoms may be. The acronym is BFAST. So B stands for balance, any sudden onset of difficulty with your balance or dizziness. E is for eyes, any blurry vision, loss of vision in one or both eyes. F is for face, facial droop. A is for arm weakness or one-sided weakness or numbness. S is for speech difficulties. Sometimes the speech difficulties come across as confusion because the person who's having those difficulties isn't understanding, what you're asking. So it may come across as like a sudden onset of confusion. And T is time to call 911, time to get to the hospital right away. Don't ignore it. Nobody's going to think that you are overreacting by thinking, oh my gosh, I'm having a stroke because I've got this numbness or weakness in my arm. Let me get this checked out. It's so important. Age range also, your risk of stroke increases as you get older, but, we're seeing strokes in younger and younger people. some side effects of COVID were like all these different coagulopathies where your blood was clotting more than normal, so that puts you at much higher risk for stroke. So we were seeing strokes in younger people also who tested positive for COVID. So those are some of the symptoms that are very, very important to be aware of, that it's not just that sudden onset of arm numbness or weakness, but...
So what would you tell someone that lives alone, if that's their worry, like the older population, like they live? I remember someone asked you.
Yes,
remember?
this is yes.
They asked you, what would I do? What do I do if I live by myself and I feel sick? What happens then?
One thing that I had suggested was, if you do live alone, is, maybe find a friend who will call you at the same time every morning. So, you get a phone call at 9 o'clock and, Mary's calling you to check on you to see how you're doing. Not necessarily to have this whole long conversation, but just to, hey, good morning, how are you feeling? How was your night? So this way somebody is checking in on you to make sure that you're okay. Because if you don't answer that phone, or you answer and your speech is off, or you're not feeling well, you can communicate that to that person, and they can help you either call 911 or make the decision to go see the doctor. But it is very important, if you are alone and all by yourself, to have some contact with somebody else.
How did you feel in December of 2020 when you heard there was a vaccine coming out? Or even how was the hospital? How was the atmosphere in the hospital like?
There's definitely relief, So initially when the pandemic first came out, it was, just stay home for 2 weeks, just stay home for 2 weeks to prevent, the transmission, and, it'll all be over, it'll all be okay. That's what the initial word was, we'll just stay home, we'll just sit tight. But, how long can you hold your breath for? So after 2 weeks, things were not better. More people were getting sick, more sicker people were coming into the hospital. So to hear that there's going to be, when can we stop holding our breath? Great, there's a vaccine out. That's wonderful. So there was some relief. There's also concern. It is a new vaccine. So, which is going to be worse, the long-term effects of the vaccine or long-term effects of COVID. So there was a lot of questions on people's minds, do I get the vaccine?
What about for you personally? What were your feelings and thoughts?
So I was also concerned. However, the science is there. Vaccines do prevent severity of illness, and I was grateful that we were able to do something. I was also very, very grateful that we finally had some testing that was more accurate. So you would know if you had COVID or not. So you knew whether to stay home. Before, it was not as accurate. The initial tests that came out, I think, were like 60% accurate. So, maybe you have COVID, maybe you don't. You tested positive, so you'll stay home. But, did you really have the COVID? Were the home tests? The home tests didn't even come out. When did the home tests come out?
Oh, wow.
That was definitely like much later on.
It was much later.
But with regard to the vaccine, we were also very lucky that we were, as hospital employees, it was offered to us. Towards the beginning, like we were like the frontline workers who were able to get vaccinated, and then we ended up being mandated to get the vaccine, or you needed to be tested twice a week. It was great that we were offered that option. If some employees did have concerns,
right,
the option to be tested was available, and it was there.
And I'll be honest with you, even until now, as I'm out in the community speaking with patients, there's still a large amount of hesitancy, right? But I find that through having meaningful conversations, we're able to help dispel some myths and provide some type of comfort through information, right? Because I'm bilingual, I speak Spanish, so I get to speak to a large amount of the Hispanic population, and they have questions in their own language, right? And I find through experience now that they feel comfortable when they speak to someone that looks like them, right? Just simply because it's a comfort thing.
Absolutely.
From Central America, I meet someone that's from Central America. Oh, let's, we start talking about our countries, and then it's just, you find that similarity in that safe spot, right? That safe place. And I find that through those conversations, we open up the door to the COVID vaccine and why, and discuss their fears, right? So they could see me that I've received all the boosters, and I'm still here. I'm okay. But then they want to know, but did you get sick? Like, what were your side effects? Did you feel something after the vaccine? And I've been one of the lucky ones. My arm hurts. That's about it, right? So, and then once I say that, then it's like, okay, so maybe I can get it. But then I'll ask them, did you get a booster? They may say, yes, I received one, but I don't know if I need all these additional boosters, right? But then it opens up the doors to other conversations about the variants that are available. And, we'll also have to keep in mind our audience. They may not understand that type of conversation, but you just let them know just the further protection. The vaccine offers further protection. It builds your immunity, and that's what you want, right? And that's been one of my biggest lessons. Just always be prepared just to have that meaningful conversation. Just 5 minutes of your time to answer these questions provides a lot of comfort for our patients, right? So, but in the ER for you, when that initial vaccine came out, did you find that hesitancy to be like I don't know, how can I put this nicely? Like, was it more them scaring you versus you scaring them? Because patients till this day, they'll tell me, don't do that.
Absolutely.
It's not good
Absolutely.
for you, right?
And there's no real basis for, well, why isn't it good for me? Basically, it's because they don't know. It's the unknown.
It's the unknown.
And you're absolutely right. Was it my scaring myself with my own knowledge of like infection prevention, or was it, hearing from other people that, oh, well, who knows? It causes blood clots. There were some fertility questions. There was a lot of misinformation that was out there, and especially with like social media, the people who talk the loudest are heard the loudest. It's funny that you were talking about side effects after getting your vaccine. I don't remember having any issues my first shot. I had gotten the Moderna. After the second, though, I came in on a Saturday. It was Saturday morning, and I needed to go to Great Adventure to go pick up my my season passes. That was definitely a mistake because I definitely felt, I don't know, I definitely felt like I had a cold, but it was just like a day. I mean, I managed to make it through the rides with my kids. I survived that, but definitely on the way home, I was much more tired, side effects wise. But it really wasn't. It wasn't anything worse. My husband had tested. I never tested positive for COVID. My husband did, and my older son, my younger son, never tested positive. But they both definitely felt miserable and lousy. And I also do attribute maybe my not getting sick, to having the vaccine.
To having the vaccine.
I can't remember now if my husband tested positive before or after. My son definitely, we were going to get him, the school district was offering vaccines, and we were going to get it for him. But he got sick right around Thanksgiving, so then we had to wait.
Now, with you all this time, what are your thoughts now? I'm not going to say post-pandemic, but the declaration of the pandemic has ended, right, as this year. What would you tell the public is, what would you recommend them to do? Now, we have St. Peter's University Hospital, we have a COVID-19 department. We're offering free vaccinations. What would you let them know about from your experience that you know about us and our vaccinating?
I would strongly recommend getting the vaccine. Vaccines are known to reduce risk of infections and severity of illness. Get tested. There's much more widespread testing. If you think you have symptoms, get tested. This way we can prevent spread of the infection.
What message would you have for yourself now? You see Maria pre-pandemic, now Maria post-pandemic. What do you feel you've learned throughout this situation? Has it made you stronger? Do you feel better prepared? For me now, being outside of the ER, I definitely miss the hustle and bustle of the ER, right? I miss that one-on-one contact with my patients. And I definitely, for me, the word that sticks out is resilient. Like how resilient our community is, how resilient our staff is, the nurses. Like we definitely came through and we pulled through. How would you describe yourself now?
Definitely much more resilient. I mean, we did come through this. This was a very, very anxiety-provoking time, and with the vaccine and with more testing options, we definitely know how to keep ourselves safe. And absolutely, one other thing that I had learned was the absolute importance of washing hands. You learn in nursing school, very important to wash your hands, very important not to touch your face. But definitely at the beginning of the pandemic, that was that was something that we definitely, I think everybody also learned the importance of washing your hands and not touching your face and
It's funny you say that. I never, I never paid attention to those little things, right? But I'm a New Yorker. I'm used to riding the subway back and forth all the time. And then I didn't think about how many times you walk in and out of that train and you're touching everything and then you touch your face and you don't realize it, right? Now I've actually, I've seen people now they carry the hand wipes,
Hand sanitizer.
the hand
Yep.
sanitizer, the Clorox wipes, and they're wiping the seats down on the train. They're wiping the handles. And for me, I mean, I find that as happy as I am that they're doing that. But now I'm like, wow, I never did that before. So I wondered how many germs did I carry around left and right, right? I'm
Right,
touching my
right.
face, I'm touching my bag, and then you don't think about it. But now we do. Now we tell everyone, wash your hands, 20 seconds, sing a song, just trying to inform patients how important it is to wash your hands, because that seems to be it's very common knowledge, right? You think, hey, we're going to wash your hands,
Absolutely.
but yes, thank you so much, Maria. This has been very enlightening. It's wonderful for me to speak to a fellow colleague, and also that has been in the ER, right? We have been their first point of contact for these patients throughout the pandemic, and it is a scary thought. Having seen these patients at their worst and then being able to see them come out at the end of, that light at the end of the tunnel. And we're here, we've learned so much, and we're pulling through. I definitely am proud of myself, and I know you're proud of yourself, and I'm happy to work alongside you and be a part of the St. Peter's University Hospital team. Maria, we appreciate all that you've shared with us. Thank you for being a guest on our podcast. To our listeners, thank you for joining us as we share our stories and experiences. Please tune in next time for another episode.